Regulatory English for SaMD, style guides that pass FDA and EMA. If you develop software as a medical device, your narratives don't just inform colleagues. They face FDA and EMA review. Reviewers expect language that is predictable, testable, and easy to verify. Clear, consistent English reduces audit risk by removing ambiguity, speeding up questions, and preventing rework. Think of style as a safety system. Good wording prevents misinterpretation the way guards prevent accidents. A style guide turns scattered rules into repeatable habits, so every author produces the same quality. The payoff is faster approvals, fewer findings, and documents your team can defend confidently under pressure. Use plain, precise vocabulary. Choose use, not utilize. Prefer risk control is effective over vague claims like seems sufficient. Keep sentences short. 15 to 20 words improves scanning and reduces misreads. Write in active voice to show responsibility. Quality reviews logs weekly. Not logs are reviewed weekly. Focus on one idea per sentence and one topic per paragraph. This structure helps reviewers map statements to requirements quickly. When every line communicates one clear point, your narrative becomes auditable, quotable, and easy to trace into tests and evidence. Open with purpose and scope so reviewers know what's inside and what's out. Next, define the device, intended user, and use context, clinicians, patients, environment, and constraints. Then walk the logic chain. Risk, right pointing arrow, control, right pointing arrow, evidence. For each hazard, state the control and the proof that it works, tests, analyses, or inspections. Align your sections with recognized standards like IEC 62304, ISO 14971, and usability guidance, mirroring their headings where practical. When structure matches standards, auditors locate requirements faster, and your rationale looks intentional, not improvised. Adopt controlled terms from a shared glossary so alert, alarm, and notification don't drift. Define every acronym at first use. Software Requirements Specification, SRS. Human Factors Engineering, HFE. Avoid synonyms for key concepts. Pick one term and use it everywhere to stabilize traceability. When a standard requires exact wording, quote it verbatim and cite the clause. This prevents debate over interpretations and preserves compliance meaning. Add a definitions section early in the document and reference it often. Consistent language turns your narrative into a system that tools and auditors can search and trust. Use shall/must for binding obligations. The system shall log authentication attempts. Use should for recommendations. Reviews should occur monthly. Mixing them blurs commitments and invites findings. Cite sources precisely with document name, identifier, and clause so reviewers can verify quickly. Example: compliant with ISO 14971 to 2019, 7.4. Always timestamp versions and authorship, document ID, version, date, and responsible role. Clear modality, exact citations, and verifiable metadata show control of your quality system and make your statements enforceable. Every claim needs evidence. Link statements to tests, analyses, or clinical data. Accuracy claim, supported by test report TR112, pass. Assign unique IDs to requirements, risks, controls, and tests. Maintain bidirectional traceability, requirement right-pointing arrow test, and test right-pointing arrow requirement, hazard right-pointing arrow control, and control right-pointing arrow verification. This lets auditors follow the thread in both directions. Record decisions and rationales when you accept residual risk or choose a control. Note who decided, when, and why. Good traceability turns your narrative into a map, not a story you must defend from memory. Use consistent headings and numbering so cross-references never drift. Prefer tables and lists over dense paragraphs for requirements, hazards, and acceptance criteria. Readers can scan and compare quickly. Standardize units, dates, and numerals. SI units, ISO-style dates, YYYY MMDD, and leading zeros where needed. Eliminate ambiguity in hedging words like may, might, generally, unless they have defined meaning. Replace with measurable terms. Within 2 seconds, 98% success, Class 2I. Readability is not decoration. It lowers review time and reduces the chance of contradictory interpretations. Before submission, run a checklist. Scope stated, terms defined, obligations marked, evidence linked, references cited. Conduct peer edits focused on clarity, gaps, and conflicting statements. Fresh eyes catch drift. Use strict version control and change logs so every revision shows what changed and why. After audits, train teams on findings and update the style guide with examples. Turn lessons into standard practice. Good documents aren't written once, they're maintained. When your process captures feedback and enforces consistency, your next audit becomes faster, calmer, and more predictable.